Right, I think we'll start. Hello, everyone. Welcome to this public session of the Oversight and Engagement Board for the 30th of July. Welcome, everyone. Bit of housekeeping. If we could use the hands up option on the participants bar for anyone that wants to ask any questions, that would be great. And then I will admit them to ask their questions. Thank you very much. So we'll go to item number 9, which is minutes from the previous meeting, the public meeting held on the 23rd of July in public session. If I will assume that everyone is happy with those minutes and sign them off as agreed, unless anyone has any burning issues with them. I'll just pause for a second while I wait for anyone to come in on that. No, it appears not. Thank you very much, everyone. We'll agree those minutes. So we go quickly to item number 10, the summary of the local surveillance data, and I invite Lucy Whiteman, our Director of Public Health, to present this report. Thank you, Lucy.
Thank you, Councillor Morris. So everybody will recall that on a weekly basis, we're now publishing data that goes into the public domain so that obviously our local residents are aware of the current situation. So this is particularly important at the moment because, as people will know, there has been an increase in the number of cases reported in Northampton and some worrying trends that we're monitoring in both Kettering and Corby areas as well. So you will notice that obviously there's a slightly different reporting format this week, and it will be key that everybody also keeps their eye out tomorrow for the updated data. So this is the data that was published last Friday, so it includes data up to the 19th of July. And people will obviously note again on the front cover of this report that we have made residents aware of the fact that there is a challenge in Northampton Borough, and obviously the information contained within the report goes into further detail. So obviously the first page, page number 2, gives us a summary of the current situation. So the rate of infection is increasing, and the amount of positive tests are also increasing within Northampton Borough. Overall in Northamptonshire, we've got a relatively static situation, but that, as I said, at a county level can hide some of the variations that are happening in our different boroughs and districts. So it's key in helping to pull out that information on hotspots. So what the challenge is here is that increase doesn't appear to be related to any specific incident or single method of transmission. So there's no smoking gun, for want of a better phrase, that we can point to and target all of our interventions at. So it's key that people understand the various risk settings and risk activities potentially causing this increase, and therefore that we as a population take collective responsibility for making sure that we adhere to the guidelines locally so that we can get on top of this situation. So the focus of this alert is central Northampton, namely the Castle ward and the Abington ward. And as I said earlier, we are closely monitoring Kettering and Corby as well, due to a pattern of increasing cases there. So we're asking people on slide 3 to obviously act now to make sure that they are adhering to national guidelines, that they keep aware of the local alerts and recommendations about best practice as well, ensure that we turn these trends around. We're reminding people about the social distancing. The 2-metre requirement is still the safest in relation to reducing onward transmission, that we limit contact with anybody outside of our household or our support bubble. So making sure that we're considering when we meet, is that meeting absolutely necessary? And if it is, can it happen outdoors, again, to reduce the risk of onward transmission? Where social distancing isn't possible, we're encouraging people to use face coverings. So they are obviously becoming more commonplace with the requirement to wear them in enclosed spaces, etc. But we're really asking people to err on the side of caution across the county, but obviously very much specific to Northampton itself. Again, to avoid using public transport or car sharing, but if you have to, and we do understand people still do need to move around, to again take these precautions around wearing a face covering and doing simple things like maintaining their hand hygiene. This was really well practiced at the beginning of the pandemic, and we're asking people to revert to those really positive activities to reduce any onward transmission. And again, where we're set up to work from home, please. Where people do in Northampton identify themselves as having symptoms, or they have any concern about they could have been in contact with people with symptoms, or they're identified as a formal contact of somebody who is confirmed COVID positive, we're asking that they do engage with the national test and trace process. So we make sure that if they are a contact, that they provide all of the details. If they seek testing, self-isolate as soon as they get symptoms, and to seek testing as soon as possible. We significantly increased access to testing across the county, obviously with a focus on Northampton at the moment. So people should find that a lot easier. If they're unable to get to a testing station, for them to utilise the home testing kits available. And for anybody who has any queries, obviously to seek assurance and information. We obviously now have been told, as of this morning, that self-isolation for cases is now required for 10 days as opposed to 7. And therefore, obviously, we'll be updating our guidance based on that new information this week. But it's key that people act urgently, that they self-isolate and that they seek testing if they have any concerns, any signs of symptoms that are identified as a contact themselves. Slide 4 shows us our weekly totals for our testing. You can see that testing has considerably reduced since the middle of May. And so again, we're encouraging everybody who has any concern to get tested and increasing access so that we can understand how prevalent the virus is in our community. Slide 6 provides us with a breakdown of the cases. You can see who they're affecting from an age perspective and from a gender perspective. So the difference in these two graphs is the one on the left, the pillar 1 cases, are those that are identified through swabbing in high-risk clinical settings. So they tend to be people who are acutely unwell and hospitalised, or staff in hospital settings. So that explains the very heavy determination around the males and females in an older age group, because they, particularly at the beginning of the pandemic, were those most affected. Pillar 2 is a more recent introduction around testing, and obviously it's testing in the wider community. You'll see a much more distributed age range in the testing age groups. Again, we know that in Northampton, in the boroughs affected, that actually the most positive cases are coming from people in their 20s and 30s. So you can see that we've moved from a period of the pandemic at the beginning where it affected older people, and they ended up really quite critically ill. This is now us making sure that we get on top of remaining incidents that is occurring in the community, in our younger age groups, who tend to be more mobile and more social, and therefore adherence to those social requirements and any other recommendations really are key to us getting back on top of this trend. So slide 6 shows, as the date for last week, the trends in relation to the number of cases in each of the boroughs and districts. And from this, you can obviously clearly see that there is an increase in the number of cases in Northampton. Obviously, the overall number of cases is greater because it's our biggest concentration of our population. But you can also see we've got increasing trends in other areas that we are really keeping an eye on. Again, you've got a similar breakdown on slide 7. So this looks at a rate per 100,000 population. So it makes comparison between different areas much easier, because it pretends basically that each area has the same size of population. So the rate for overall in the county at this point in time was 451.2 cases per 100,000. And you can see from the data that Corby, Kettering and Northampton there have higher rates compared to the Northampton average. And in Kettering and Northampton, that was statistically significantly higher. So you can see why we've been focusing our attention and our action on those areas. That's really easily illustrated in a cumulative graph on slide 8. And again, that shows a breakdown for each of our boroughs and districts. So if we look a little bit more closely at where's most affected, you can see on slides 9 and 10 and 11 and 12, in fact, deep dives in cutting the data in different ways about how they affect different populations. So again, you can still see on slide 9 that we've got that greatest concentration of case numbers in Northampton, but you can see Kettering and Corby also significantly affected. It is worth noting that obviously we see variation on a day-to-day basis. So what we do with Public Health England and with our regional Department of Health and Social Care colleagues is make sure that we're looking at trends over time so that we can see if there's a consistent pattern that needs addressing. Again, based on that cumulative case rate by community at a 100,000 per population level, so again, just making comparison easier, you can see the areas of focus. So Wellingborough as well is an area that we've been looking at over the last couple of days, but you can see last week was starting to flag. Because there's small numbers in Wellingborough, that does sort of dip in and out, but these are cumulative case rates, so you can see the picture building over time. So more particularly in the last 28 days, this slide 11 shows that there is that increase very much focused on the 2 northern boroughs and districts and the town centre. Again, it's because the pattern of infection has changed over time and the people affected has changed over time. It is worth always looking at more recent data so that it's not skewed by the earlier older population that tended to be focused in care homes and hospital settings, those clinical settings, because they needed that level of support. This is much more recent data showing the community incidents. And again, that deep dive as a rate per 100,000 population on slide 12 gives a similar picture. So if I stop there and see if there are any questions before we talk about, well, how are we addressing these issues? I think that's probably the best point to take a quick.
Thank you, Lucy. One question that I think I would ask, I'm just seeing if anyone else has got any questions, but if you could put us in the context of where we sit geographically, i.e. the counties around us, and what the impact that may or may not be having, that I think would be very helpful. Thank you. And I'll if you could answer that, and I'll just see if there's any other questions that don't appear to be at the minute, but over to you, Lucy.
Councillor Morris, it's a really good question. And obviously the Department of Health and Social Care and the Chief Medical Officer, when they make decisions about which areas need, support or list or even, as we've seen in other areas, significant support with their interventions, they do very much take that wider view. So Northampton geographically is surrounded by areas that have actually got levels of intervention in them already. So people will be very aware of the fact that to the north of us is Leicester City, Peterborough, Luton and Bedford have also been on the watch list or are in intervention at the moment with support from health and social care colleagues at the regional and national level. So geographically, we know that we are in a position where we're surrounded by high incidence areas. We know those people do work and live and socialise across into Northamptonshire. And obviously we've got significant distribution centres and we've got significant transport that traverse our county as well, all of which will, affect to an extent how our case rates play out. Of course, we're making sure that as we identify new cases through that test and trace process and through some local contact tracing that we're doing ourselves to understand how people may have been exposed to the virus, we're trying to ascertain where the likely source of infection is. But geographically, you're right, we're in a position that is quite challenging, and there are a number of areas in significant escalation mode around us as well.
Thank you, Lucy. I don't appear to have any other questions at the moment. So if that's okay with you, we will move on to item 11, which is more digging down into the local situation update for Northampton, Kettering and Corby. Over to you, Lucy.
Thank you. So colleagues will be aware that we have been having daily meetings, daily situational report meetings. So a number of colleagues have been joining us on a day-to-day basis for a significant period of time now, both from the upper tier local authority, from health, and also from the lower tier local authorities, because they play a key part in this, so that we are all clear about what the current situation is, and we are working on comms and engagement work and enforcement work together. Those were sort of stepped up to include a very specific focus in Northampton, obviously as we became aware of the escalating situation. I cannot thank my colleagues in our boroughs and districts enough, and a number of members of our NHS community as well, as we've worked together to make sure that there's a significant increase in our activity locally. So I will wait and allow Commons colleagues to provide an update on the communications work that's been going on. But just to summarise some of the work that our environmental health officers and our community leaders have been doing, with full support of the chief executives and leaders at the lower tier local authorities. So our environmental health officers have been actively engaging from before this became a situation in Northampton, with the significant employers in their areas. They're making sure that all of those premises are COVID secure as they open, and people will be well aware of the signage, etc., and the availability of sanitizers, etc., in areas to make sure that obviously businesses open safely. They've also been working through our testing centres to make sure that we're able to identify sites for testing opportunity. So Kettering at the moment is going live with what's called a local testing service, which is a walk-in opportunity. So where we've had mobile testing units dotted around the county and moving to provide coverage, we're now making sure that the areas of focus with Northampton's going live tomorrow, Kettering goes live today, and we're looking at sites in Corby as well, for those walk-in opportunities based in the areas of high prevalence or that are easily accessible for people, sort of in central areas, shopping centres, etc., so that we can make sure that people, if they are concerned, can access testing easily. As I said before, we're also encouraging the use of home testing kits for those that can't get out and about. We do recognise not everybody is mobile, so we need to make sure people are aware of the opportunity to get testing brought to them as well. Our EHOs are making sure that we've got increased presence on the high streets, particularly at the weekends where we find that people socialise more, because we know that the age range affected most are younger people, so people again in their 20s and 30s, making sure that they are reminded of best practice and that obviously they've got access to any information that they need to be able to do so and make our communities as safe as possible under the current situation where we've got some increased risks. Commons engagement, as I said, will be touched on earlier, but we are making sure that we're working with key organisations, particularly in those hotspots, to make sure that people are able to get the information they need and the support that they need.
Thank you, Lucy. Very comprehensive answer as always. I know there's been some criticism of you not necessarily being out there in the public enough, but I can attest to the fact that you attend an awful lot of meetings and you always give very, very good answers to any questions that are given. And in fact, you did a very good interview last week on the radio. So I think we can park that criticism, and you are also dealing with a pandemic, and perhaps you should be concentrating on that rather than the media. But I'll just leave that as an aside. So we're going to come on now to comms and engagement update. And I think Liam, are you leading on that? Liam, if I can bring you in.
Yes, good morning. Yeah, happy to talk everybody through that, Councillor Morris. It's been a very busy week since we last met, and the announcement of Northampton being on the watch list. We developed some key messages which Lucy's just touched on, about staying safe, and also anybody with symptoms to get a test. Press releases have been issued throughout the week, and we held a press conference on Friday as well, which is well attended, and there's one scheduled in for this Friday as well. The key messages also formed a leaflet which was printed very quickly and distributed to 2 principal wards in Northampton, Castle Ward and Abington Ward, 11,500 in total, which is quite an achievement. The testing information is being held centrally on a page on the County Council website, and that's being updated twice a day. And borough and district colleagues are helpfully linking to that as well, and that's being promoted on social media, so people are sort of encouraged to get a test as well. A lot of social media about staying safe and testing information. Also some targeted social media with Facebook and Instagram, targeting relevant age groups, which Lucy's just highlighted, and demographic. The comms have also been developed in a number of different languages. So that's in audio and video, including Polish, Bengali and Romanian. Highways have also been involved with the VMS signs being used to display the relevant information. And we've also distributed a full package to the business community with a letter from Public Health, giving messages, a COVID advice poster which can be put up in the workplace. And the sort of general message here is don't leave COVID at the door. So stay safe in the workplace, but then when they go home, want to avoid them car sharing. If they do need to use public transport, to wear a face covering, etc. So it's been a busy week and quite comprehensive comms been put out. Thanks.
Thank you, Liam. Thank you, Liam. And I'm no doubt that the comms plan will evolve as we go along, and it's very much a movable feast in that sense. But I've been very impressed, as have colleagues, with the comms plan so far. So thank you very much for all your efforts on that front. I was just going to ask a question of Lucy, if I may, very quickly. And I think some of the success can be shown by the numbers of tests that are now being carried out. I mean, it's definitely each testing site has shown quite significant increases in numbers, I believe. So I know I'm going off piste a bit, sorry, Lucy, but would you mind commenting on that a little bit, if that's okay? Because I think that is a sign of success in a sense, isn't it? That we are getting more and more people to these testing centres than perhaps would have gone before.
Yeah, absolutely. So the public have responded really positively to this. You know, we do recognise that it's very challenging under circumstances. People are only just starting to get a taste of freedom again, and then we're asking them to restrict their movements again. But you know, we can see how this can play out if we don't get on top of these trends from the much more severe restrictions that have had to be taken elsewhere. But yeah, the positive response to the availability of testing and the increased messaging around the importance of testing has been brilliant. You know, we were so impressed with the response at the beginning of the pandemic by the public around their level of compliance with the national recommendations, and we encourage people to continue to be vigilant. And if, as I said, if they've got any concerns around COVID, that they seek testing, and they can do that through the website, or if they struggle with doing that online, they can call the COVID telephone number so that somebody can help them do that. As I said, the local testing services are walk-in as well. So as and when those get established in each of the areas, it provides people with an alternative route. One of the key ways that we're going to get on top of this is by understanding exactly what the challenge is and what the rate of infection is in our communities. So the more people that get tested, the more we understand how best to target our interventions, and the more successful we're likely to be on getting on top of this before we have to take further steps around lockdown and etc. Those are absolutely the steps that we want to avoid.
Thank you, Lucy. I think those are very key messages, and it is a big ask of the people of Northamptonshire and Northampton and those affected areas, but I don't doubt that they're not up to the task. I think they will very much step up to the plate to help suppress these numbers. I've got another item, any other business. I'm just going to scroll through, see if anyone has any other business. Doesn't appear so, in which case we've got some future meeting dates, which I'm just going to run through. We've got the 6th of August at 11 a.m, the 13th of August at 9 a.m, the 20th of August at 9 a.m, and the 27th of August at 9 a.m. I think most of those dates have been cleared with most people anyway, but if you could make some time for those meeting dates, that would be brilliant. And I think that's all it remains for me to say is thank you very much for coming today, and thank you for your time. And I'll see you at the next meeting. Thank you very much.
Thank you.